Hello viewers, welcome back to our channel. Today, we have an important topic to discuss. The signs that your body may be giving you to indicate that your heart might not be in the best shape. Your heart health is crucial, and it's essential to be aware of any potential warning signs. Without further ado, let's dive into the details. For more interesting topics related to health and wellness, ensure you subscribe to our channel. Just click on the subscribe button below this video, and make sure you turn your notification bell on. Heart disease, also known as cardiovascular disease, is a prevalent health issue in the United States. According to the Centers for Disease Control and Prevention, heart disease remains the leading cause of death for both men and women globally. It encompasses various conditions, including coronary artery disease, heart attacks, heart failure, and other conditions. It's important to note that these conditions are often associated with lifestyle factors, such as unhealthy diet, lack of physical activity, tobacco use, and excessive alcohol consumption. Over time, the heart condition can result in shortness of breath, high blood pressure, brain damage, restrict blood flow, and cause death. However, knowing the signs of a weakened heart muscle is very essential to promote preventive measures against heart disease. So, what are these signs to know if your heart needs medical attention? 1. Your heart needs instant medical attention when you have chest discomfort or pain. Yes, don't take this condition lightly without giving it proper medical attention. Chest pain occurs when the heart muscle doesn't receive enough oxygen-rich blood. It can feel like pressure, squeezing, heaviness, or a dull ache in the chest. In other words, it can result in a heart attack with other associated symptoms like shortness of breath, pain, nausea, lightheadedness, or cold sweats. Sometimes chest aches can occur from acid reflux or gastroesophageal reflux disease, a burning sensation in the chest. However, keep in mind that not all chest pain or discomfort is related to the heart. It can also be a result of anxiety or panic attacks, lung problems, or other non-cardiac conditions. To prevent heart conditions that may result from chest pain, it is advisable to adopt a heart-healthy lifestyle and take proactive measures. Avoid excess weight to prevent strain on your heart, which may trigger the risk of developing heart conditions. In addition, consume balanced diets and engage in regular exercises. High blood pressure, also known as hypertension, is the second risk factor to consider. High blood pressure occurs when the force of blood against the walls of the arteries is consistently too high. Over time, this can cause damage to the blood vessels, including those in the heart. When the heart has to pump against elevated pressure, it can lead to a weakened heart muscle. Also, know that uncontrolled high blood pressure can contribute to the development of plaque in the arteries. This can lead to reduced blood flow and potentially result in a heart attack. It's important to avoid the causes of high blood pressure and consider a healthy lifestyle instead. Remember, regular checkups and monitoring of blood pressure are essential to detect and manage high blood pressure effectively. The third sign that indicates a faulty heart is fatigue and tiredness. Feeling tired and lacking energy could be due to impaired heart function. Heart conditions can manifest through consistent fatigue and weakness. When the heart is unable to pump blood efficiently, it can lead to reduced blood flow to the muscles and organs. As a result, it can cause feelings of tiredness and lack of energy. However, you must avoid the factors that influence constant fatigue and tiredness. Ensure you're getting enough restful sleep each night. It's important you note that insufficient sleep can trigger heart issues, so don't miss your relaxation time. Also, drink enough water and stay hydrated to prevent fatigue and muscle weakness. It's also important to remember that this is not an exhaustive list, and the causes of fatigue and weakness can vary widely. If you're concerned about your symptoms, we recommend speaking with a healthcare professional who can evaluate your specific situation, conduct any necessary tests, and provide appropriate guidance. The fourth sign to consider as an indicator that your heart needs medical care is constant dizziness and fainting. Dizziness and fainting can be related to heart disease through different mechanisms. One possibility is that reduced blood flow to the brain can lead to dizziness or fainting spells. In some cases, certain heart rhythm abnormalities, such as arrhythmia, can cause fainting spells. Another potential cause of dizziness or fainting in relation to heart disease is when there is a drop in blood pressure when transitioning from lying down or sitting to standing up. If you or someone you know experiences recurrent dizziness or fainting, it's crucial to seek medical attention to determine the underlying cause. A healthcare provider can evaluate your symptoms, conduct a thorough medical history review, perform a physical examination, and order appropriate tests to diagnose and treat any potential heart-related issues or other conditions contributing to the symptoms. Let's move to the fifth point, which is high levels of low-density lipoprotein cholesterol, also known as bad cholesterol. This condition can be an indicator that your heart is not in good shape. It is responsible for transporting cholesterol from the liver to various tissues in the body, but when it is present in excessive amounts, it can lead to the buildup of plaque in the arteries. Several factors can contribute to high levels of low-density lipoprotein cholesterol levels, including genetic predisposition, an unhealthy diet, lack of physical activity, obesity, and smoking. Additionally, certain medical conditions such as diabetes and hypothyroidism can cause high levels of low-density lipoprotein cholesterol. It is important to note that genetics can play a significant role in determining this condition level in people as well. To manage bad cholesterol levels, lifestyle modifications are usually recommended as a first-line approach. These include a healthy diet, regular exercise, weight management, and other proactive measures. Regular monitoring and follow-up with a healthcare professional are essential to evaluate the effectiveness of lifestyle changes and medications in managing high bad cholesterol levels. The sixth sign is an irregular heartbeat. Ensure you don't take this lightly, because your heart's rhythm is vital for its proper functioning. If you notice palpitations or irregular heartbeats, it could be a sign of heart problems. Irregular heartbeats can indeed be a sign of heart problems. Palpitations refer to the sensation of a rapid, fluttering, or pounding heart, and they may be accompanied by an irregular heartbeat. While occasional palpitations are usually harmless and can be caused by factors such as stress, caffeine, or certain medications, persistent or recurring palpitations should not be ignored. There are several heart conditions that can cause palpitations or irregular heartbeats. These conditions include arrhythmias, heart valve problems, coronary artery disease, cardiomyopathy, and heart failure. If you experience persistent or concerning palpitations or irregular heartbeats, it's important to consult a healthcare professional. They can evaluate your symptoms, perform diagnostic tests if necessary, and provide appropriate treatment or refer you to a specialist such as a cardiologist. The last sign you should consider as an indication that your heart is not functioning well is swelling in your legs, ankles, and feet. Fluid retention and swelling in the lower extremities can be a result of a struggling heart, specifically a condition known as peripheral edema. So what is edema? Edema refers to the accumulation of fluid in the body's tissues. Peripheral edema specifically affects the lower extremities, such as the legs, ankles, and feet. One common cause is congestive heart failure, where the heart's pumping function is impaired, leading to fluid buildup in the body. In this condition, the weakened heart is unable to efficiently pump blood, causing blood to back up into the veins. This increased pressure within the veins can force fluid out of the blood vessels and into the surrounding tissues, resulting in swelling. If you're experiencing persistent swelling in your legs, ankles, or feet, it's crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment. They can evaluate your symptoms, go through your medical history, and perform any necessary tests. These will determine the underlying causes and provide the necessary care. In conclusion, it's essential to pay attention to your body and recognize any signs that your heart may not be well. However, keep in mind that these symptoms are not exclusive to heart problems and can have various causes. If you experience any of these signs or are concerned about your heart health, we strongly recommend consulting a healthcare professional. Remember, early detection and timely intervention can save lives. So far, you have learned a lot about the signs that indicate that your heart might not be in the best shape. Comment below to ask us some questions related to this health topic. We assure you to reply immediately and guide you through if you need more explanation. If you found this video inspiring, subscribe to our channel for more amazing health and wellness topics. Just click the subscribe button below, and don't hesitate to turn the bell on to receive notifications of our wonderful health topic videos. Thanks for watching, and take your time to watch our previous videos.